a soft tissue mass. If the mass is located in the limbs, first of all, you have to compare both limbs. For example, this mass we have here is located in the right upper limb. To examine, you start with inspection and you pick the two upper limbs and check symmetrically. Once you are sure there is no swelling on the left, you leave the left. You now focus on the limb with the swelling. Then you inspect the swelling. Note the site. Here, this swelling is located in the dorsum, on the dorsum of the right hand. You note the site. Then note the shape of the swelling. This swelling is hemispherical, or you can say globular. Then you note the skin over the swelling. The skin appears normal. Then you note the surrounding. The surrounding appears normal. After inspection, you palpate. Palpation starts with checking for differential temperature. You bring the other hand that is symmetrical. If it's a big swelling, you use the dorsum. You use the dorsum. You use the dorsum of your fingers. But if it's small, you use only 2 fingers. So to check differential temperature, you start with the normal. You touch, feel for some seconds, then feel over the swelling, then go back to normal. You'll be able to notice if there is differential temperature between the two. Then after that, you check for tenderness. To check for tenderness, you look at the face of the patient and then you touch the swelling while looking at the face of the patient. You touch at least in 2 places, depending on how big the swelling is. If the swelling is very big, you touch maybe up to 3 places while looking at the face of the patient to see whether there is any sign in the face to suggest tenderness. Is that clear? Then, after checking for tenderness, you estimate the size of the swelling in 2 dimensions. First, you check vertically, and then you check horizontally. You can use a tape, or you can use your fingers, but you check in the vertical plane and then in the horizontal plane. After that, you palpate the swelling, first of all, superficially, making circular motions to appreciate the surface. The surface of this swelling is smooth. Then you feel the edge to see whether it is well defined. Some swellings will demonstrate a sleeping sign, like lipoma. Then you check the consistency proper by applying deep pressure with the pop of your finger. Because the swelling is small, I use 1 finger. If the swelling were big, you use all your fingers to apply deep pressure. So you feel it against the background. This swelling feels firm. Then after that, you check for skin attachment. You pinch the skin above the swelling. If you can pinch the skin, it means the swelling is not attached to the skin. like in this case, we can pinch the skin above the swelling. You get it? Okay. Then after that, you check for mobility. You hold the swelling, move it side to side, and move it up and down. Then after that, you check to confirm if it's attached to the underlying muscles. Because a swelling could be mobile, side to side, up and down. But when you now put the muscles underneath, under tension, it will no longer be mobile. That means it's attached to those muscles, or the mobility will reduce. How do you put the muscles under tension? By putting resistance against their normal function. Like this is the dorsum, and the dorsum is the extensor compartment. So you expect the muscles there to extend the fingers. So while you place your palm above the fingers, you ask the patient to extend against resistance. Then as the patient is doing that, you now try to move it. You see, it's no longer mobile. So it means that this swelling is attached to those muscles that serve that function. Finally, you examine the regional lymph node. This swelling is located in the hand. The lymphatics in the hand and upper limb eventually drains to the axilla. So to the regional lymph node we are going to examine here will be the lymph node in the ipsilateral axilla. So you shake the patient with your right hand, and then you begin to examine the lymph nodes in the axilla. After that, you have examined the swelling. You can make diagnosis. This swelling in this case is a ganglion. It's a ganglion because the swelling is located in the dorsum of the hand, which is a common location for ganglions. Although you expect ganglions to be cystic, if they are long-standing, they could become firm, like you find in this case. What gives it away as a ganglion is the fact that when you put the muscle under tension, the swelling does not move. And ganglions are mostly formed by the tendon sheath of the muscles in that compartment. If this is extensor compartment and this swelling does not move when the tendon, the muscle is acting, then it must be arising from the tendon sheath. So it is a ganglion. Thank you.